Now with Ben Stiller revealing his fight with cancer. In a blog, the actor wrote, quote, "I got diagnosed with prostate cancer Friday, June 13th, 2014. On September 17th of that same year, I got the test back telling me I was cancer-free. The 3 months in between were a crazy roller coaster ride with which about 180,000 men a year in America can identify." Stiller also talked about his diagnosis in an interview with Howard Stern.
At first, I didn't know what was going to happen, so I was scared. I was scared. I didn't know. The one thing that it does is it just stops everything in your life. One of the main things I felt was I was really lucky as I learned more about prostate cancer. I learned that, I was someone who had, a case that could be treated. There are a lot of people who can't.
Stiller credits a diagnostic test known as the PSA with saving his life, but the guidance is a little bit mixed, both on just how valuable that test is and when men should start screening. We asked Dr. Mehmet Oz to stop by and walk us through it. Doc, good to see you.
Good morning.
He was 46, no history, no symptoms. Is he the kind of guy who should get a PSA test?
Well, there's a reason that all the major medical societies and United States Preventive Services Task Force agree that it should not be part of routine screening. Because for every 1,000 men who get screened for the PSA, you only save one life. And so identifying who that one person is becomes a bit of a challenge.
So you're saying it's a double-edged sword because in addition to the one person, and he says that test saved his life, you get a lot of other false positives and people who might go for treatment when it's not necessary.
It may have saved Ben Stiller's life, but just to be clear, he didn't jump into surgery when he was diagnosed. He took a while to figure out if he could do things to reduce his PSA number, and that's the big problem. A lot of men panic when they have an elevated PSA. What is a PSA? It stands for prostate-specific antigen. It's a protein released from prostate cells. It doesn't mean you have cancer. It means there's something wrong with your prostate. It could be an infection, inflammation, irritation, or it could be cancer. But if you're a man sitting home right now, or you're the spouse, the loved one of that man, you're probably going to be panicked if your spouse has an elevated PSA. So you run off to the doctor to get it whacked out, and that causes impotence. It causes problems with retention and incontinence. It can cause all kinds of problems, including sometimes people die during those operations.
So what you're saying is after you get this simple blood test and you get a number of your PSA, you don't treat the number. You treat the entirety of the patient.
Just like Ben Stiller did. You go out, see the best experts out there. You do things that might make sense for you. And treating your, for example, if you have an infection, treat the infection first. Don't immediately assume you need to get biopsies done and have a prostatectomy.
But the message, as I mentioned, is a little bit mixed. So what would you say to the 50-year-old guy sitting out there right now with no family history and no symptoms? Should he or should he not get the PSA screening?
I would follow the government guidelines and not routinely screening myself with PSA. But here's the catch. If you ask me, Matt, what would Mehmet Oz do? Right? Or what would I ask you to do if I was a friend and trying to help you? I'd say get the test, and here's why. Information's power. If I have an elevated PSA, I can do a couple things. I can look for a problem, or I can start doing things that might reverse the chances of my developing advanced prostate cancer, because we now have data on how powerful lifestyle is. And remember, prevention and detection, they're not the same thing. Detecting whether you might have an elevated PSA in prostate cancer is not the same as acting differently in your own life. And the things that work, for example, that prevent heart disease from killing you also work for prostate cancer. So fruits and vegetables, making sure you have high omega-3 oily fish in your diet, whole grains, not so much sugar, a little activity, exercise. These reduce the chance of actually dying from prostate cancer. And that may be the biggest takeaway. That may be the Ben Stiller effect. Be aware of how powerful this is. We're coming back here, as you know, in 2 weeks.
Right, doing these issues.
I'm at Men's Health on the Today Show. We're going to cover all of these because there's a whole opportunity there.
Dr. Oz. Doc, always good to see you. Thank you very much. Of course, you can see more of him weekdays on the Dr. Oz Show. Check your local listings.
Hello, Today fans. Thanks for checking out our YouTube channel. Subscribe by clicking that button down there and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives.